Calling on Delegate Jacqueline Wilson, virtually. 3 Wilsons in the house.
Thank you very much. Thanks for the opportunity to delegate. My name is Jacqueline Wilson, and I'm a lawyer at the Canadian Environmental Law Association with Ms. St. Pierre. And I'm also a member of the Low Income Energy Network, which is a joint program of CELA and the Advocacy Centre for Tenants Ontario, which deals with energy poverty issues. Although we're pleased to see Hamilton Community Health Response Plan, we're calling on the Public Health Committee to pass a maximum heat bylaw, or look into and then pass a maximum heat bylaw, which would align with action item 3.3 in Hamilton's Climate Adaptation Plan, which looks at coordinating local efforts to address excessive indoor temperatures in rental housing. Climate change has already and will continue to cause increasingly extreme heat in Hamilton particularly, and low-income and vulnerable people are most impacted. Indoor temperatures in apartments can get incredibly hot and stay incredibly hot during an extreme heat event, to the extent that it's dangerous to live in an apartment that does not have active cooling. There needs to be an adjustment in the way that we think about this issue. We all intuitively know and understand why we need heat in apartments, and unfortunately, the climate crisis has reached the point where active cooling is utterly essential too. Ms. St. Pierre mentioned Hamilton's broad authority to pass a maximum heat bylaw. I draw everyone's attention to Section 8, Sub 1 of the Municipal Act, which provides that the powers of a municipality are to be interpreted broadly. Section 10, Sub 2 provides that a single-tier municipality may pass bylaws respecting. Subsection 5 is economic, social, and environmental well-being of the municipality, including respecting climate change. And subsection 6 of that same section allows for bylaws looking at the health, safety, and well-being of persons. And this issue falls squarely in that mandate. My colleague, Ms. St. Pierre, also mentioned the Spray Tech and Hudson case, which again is very important authority for Hamilton to pass a maximum heat bylaw. That case was decided in 2001, and it's still the leading case on the interpretation of municipal powers, but also on how conflicts are understood if it should arise with provincial or federal legislation. In that case, the town of Hudson, Quebec, adopted a bylaw to restrict cosmetic pesticides, and several companies contended that the bylaw was beyond the jurisdiction of the municipality, or as a second argument, that it was inoperative due to conflict with different rules, but still addressing pesticides in provincial and federal legislation. The Supreme Court upheld Hudson's bylaw. The Supreme Court pointed to general welfare provisions in Quebec Cities and Towns Act, and specifically noted that the omnibus provisions that were the underlying basis for their finding a jurisdiction allow municipalities to respond expeditiously to new challenges facing local communities, and that the Ontario Municipal Act contains similar provisions. That case from the Supreme Court also found that there's a presumption that bylaws are valid. And I would note that this decision was followed in Ontario in the CropLife case in 2005 at the Court of Appeal. I wanted to address the question about the Health Protection and Promotion Act. One of the key sections of that act is Section 10, which allows every medical officer of health, there's a mandatory requirement, shall inspect or cause the inspection of the health unit served by him or her for the purpose of preventing, eliminating, and decreasing effects of health hazards in the health unit. So there is a broad authority through that section as well when there's such a clear health hazard as extreme heat. In response to Councillor Paul's question about whether this has been done before, Montgomery, the county in Maryland, passed a law creating a maximum temperature in February 2020. It's Bill 2419 in that jurisdiction. The basic requirements are quite similar to what CELA has also put in the model bylaw that my colleague was mentioning. In Montgomery's law, it says that where cooling is not under the control of a tenant, each owner of rental housing must maintain a temperature of no more than 80 degrees Fahrenheit, which is 26.6 degrees Celsius. The requirement applies to each habitable space, and it's measured at a distance of about 3 feet from the floor, which is approximately a meter. That's section 26 to 7 F2 of their law. There's some other elements in the Montgomery law which provide a useful model or something to consider. For instance, it allows landlords to apply for a 6-month extension to compliance if landlords must have electrical upgrades to the rental housing to comply, and making the upgrades would cause financial hardship. I'm going to end my delegation there. Hamilton has declared a climate emergency, and what that means is taking steps like this, recognizing how serious this problem is, and the problem is only going to get worse. We need to take action immediately with a maximum temperature bylaw to avoid any harm to our most vulnerable communities. Thank you.
Thank you, Delegate Wilson. Councillor Clark.
Thank you, Deputy Mayor. In reviewing the draft bylaw, it indicates adequate and suitable cooling means an indoor temperature in the dwelling unit that does not exceed 26 degrees Celsius. I don't see anywhere in the bylaw where it speaks to humidity. 26 degrees, 100% humidity is significant, and cautions should be awarded. Should the bylaw include humidity, humidex?
So thanks for the question. The way that extreme heat events are declared by public health units is either through the actual temperature or through humidity. And so the way that, the heat response plan, for instance, is triggered is through kind of a joint look at both heat and humidity. That being said, the literature that does point to the 26-degree marker is looking at that threshold for actual temperature indoors. CELA has prepared a report on maximum heat, which highlights some of the reasons that we're pointing to 26 degree. And I'll just give you a few off the top. The first is the BC Centre for Disease Control, which found that people were most in danger when indoor temperatures remained above 26 degrees throughout the event. There's also a study in New York that found that humidity exposure and indoor heat above 26 degrees increased the proportion of emergency calls due to cardiovascular or respiratory distress. And I'll mention one more, but it is in our report, so you'll be able to see the citations. A study by the American Journal of Alzheimer's Disease and Other Dementias found that the symptoms of dementia were significantly exacerbated when patients were exposed to temperatures above 26 degrees.
I can speak to that. Cutting the lawn on that hot, humid day, you kind of forget your own name at times. I'm trying to understand the relationship of humidex to the minimum or the maximum threshold for heat, which is being suggested in your bylaw. Can you speak to what happened in British Columbia? They had a significant heat emergency, as did Quebec and Chicago in recent years. So can you speak to just one of those if you have any information on it, what transpired?
Sure. So British Columbia did a really thorough report after that awful heat event in 2021. And I think my colleague mentioned some of the findings, which are really significant and underlie why it's a maximum heat bylaw in your unit, which is necessary to deal with the policy problem. What that found was that it was vulnerable people who died during the extreme heat event. So as she mentioned, 90% of the people, it's 619 people who died during that heat wave were over 60. 91% were registered with at least one chronic disease registry. Deaths were higher in socially and materially deprived neighborhoods. Poor quality housing, homelessness, and overall deprivation were identified as risk factors for increased mortality, and 98% of heat-related death occurred indoors. In Quebec, there was very similar finding after the 2018 heat wave. Elderly people So those that were socially isolated and those with chronic diseases or psychotic disorders were most vulnerable to heat. The majority of people who died lived in an urban heat island, like Hamilton. 8 of the 53 people who died lived in a senior's home that didn't have cooling. And most of the people died without access to air conditioning. And so what's quite striking about those findings is how similar they are to each other in terms of the people that are most vulnerable to heat.
Thank you, Delegate. Councillor.
Yes, thank you very much, and I would agree with you that it is quite striking when you look at those examples and how similar they all occurred. So thank you very much for your input today, Jacqueline.
Thank you very much.
Thank you. I see no further councillors on the speakers list. Thank you, Delegate Wilson.
Thank you.